Hey, I'm Dr. Jerry Williams with Urgent Care 24/7, and I'm here to talk to you today about just health insurance and healthcare costs in general. And you're going to see me looking down because I've got some statistics here that I want to talk to you about. And I'm looking at a Congressional Research Service report that is from 2019. And basically, there's 323 million people in the U.S., and we spent $3.6 trillion in 2019 on healthcare related expenditures. 3.6 trillion. So I'm not exactly sure if my calculator is going to allow me to do 3.6 trillion, but we're going to try it. And it did allow me to do that. So we got 3.6 trillion divided by 323 million. And that's $11,145.51 per person in the United States. Now, that's taking all things into account. That's inpatient, outpatient. This is healthcare related expenditures. But think about this. From the research that I've done, approximately 30% of healthcare expenditures are administrative overhead. So 30% of 3.6 trillion, which is going to be about $1 trillion, thereabouts, goes to overhead, which is the processing of claims and the management of claims and so forth. So what if we certainly don't need to be cutting dollars to healthcare costs, but what if we could more efficiently manage our healthcare expenditures nationally as a country more efficiently with less administrative overhead? Now, the private insurance company CEOs that make tens of millions of dollars a year in salary aren't going to appreciate that. But I don't really care about that, do you? But if we could take some of those dollars and operate our system more efficiently and direct those savings towards improved and increasing access to care, for example, the roughly 9 or 10% of the people in the U.S. that have no coverage at all, no Medicare, no Medicaid, no private insurance of any kind, what if we could insure those 10%? With the savings and administrative overhead, and then everyone would have coverage? How cool would that be? So I just wanted to talk about how big the numbers are and what we're looking at and how much administrative overhead or fat is built into that equation, so we can just have a discussion about how do we fix this mess, this problem we're in, because it's a mess. I can tell you that we at Urgent Care 24/7, my urgent care company, which is a national urgent care company, we don't accept insurance or third-party payment of any kind because most people are operating under their deductibles. 80% of all patients never meet their deductibles, so they're paying out of pocket anyway. So why add the administrative overhead to that 80% of patients, that 30% overhead? Why add that to the equation when we can, for primary care and urgent care, low dollar expenditure, underneath the deductible threshold, we can take care of these patients under here without that 30% overhead. That'd be a huge savings right there. So just wanted to have the discussion. I think it's important that we have an open discussion and debate about topics such as this. But I don't think anybody would argue the fact that it would be great if we could operate our healthcare system more efficiently and direct those dollars towards insuring uninsured people and increasing access to care and increasing benefits, direct healthcare to people who need it, and less to administrative overhead. Anyway, I'm Dr. Jerry Williams with Urgent Care 24/7. Life is 24/7, and so are we.